My name is Dr. Robert Morrison. I am the founder and CEO of Morrison Dental Group. I have had the honor to be able to watch this organization grow into what it is today. I was a Navy veteran for 10 years, and right before coming to Williamsburg, where we started Morrison Dental Group, I was at the U.S. Embassy in London. I started Morrison Dental Group in 1992, 1131 Professional Drive. It was just me and a few staff. The reason that I started Morrison Dental Group was probably an accident. It was also in context with what was happening within the healthcare and dental industry, in that we grew because we were blessed. We had enough business and we needed to expand. And then it turned out that other people wanted what we were providing. And that's not just dental service, but it's customer service. And that leads me into the second part of the question is, what are our core values? And our core values are what we live with every day. We hire it, we are on it, we acquire on it, and they were developed by our own staff. Our staff came up with these core values because that's what's important to them, that's what's important to us. And it includes things like always deliver wow service, do the unexpected. Patient first mentality, certainly. But embrace growth and change. It also is respect each other's hard work and achievements. It's also about having open, honest, humble, and respectful relationships, not only with our patients, but with each other. We grew because what we were providing resonated with our patients and our community. And then other communities wanted it. We grew also because of the talented individuals that work here. One of the things we're most proud of is our management team, now that we've grown to 9 offices, is homegrown. They started on the clinic floor. They started behind the front desk. That allows us to keep our core values and our culture intact. We used to think goals for the patient would be show up on time. Now it's participate in your own health care. Not just dental care, but health care. Because what we do is not outside of the body. It's a part of the body, and it needs to be a part of the solution to their own health care. The goals for Morrison Dental Group goes back to our vision statement. We will be the patient's advocate in all things healthcare. And so our goal is to live up to that every day. Sometimes that means don't treat the patient. Sometimes it's get them other care. Sometimes it's find a better dental home for them at a community clinic if that's appropriate. And it's also being that we need to be that patient's advocate. And we always must stay with one of my long-term statements that my employees probably are tired of hearing, which is we make treatment decisions with a patient, not for a patient. We'll always do the right thing. We're going to do the right thing for the patients. We're going to do the right thing for our staff. We're going to do the right thing for the community. And some of the things that we do within the community embody what my leadership, if you want to call it that, is all about. The doctors that we have a wide range of talents.
So it has one cavity.
We need a wide range of talents. Everybody has strengths and weaknesses. What do I look for when I'm hiring a doctor? I don't ask doctors how fast they can do something or how well they do it. I ask about them. I want to know about them as a person. So when I'm asked, what do I look for in a doctor? It's very simple. It's one word. It's integrity.
So we were on our way back from London, and Dr. Morrison was looking at practices to purchase. And I'll never forget, we were in Philadelphia at the time visiting my family, and he had a notepad with several bullet points of this great dental practice he wanted to look at. And at the bottom, it said location Williamsburg, Virginia. At which point I looked at him and I said, really? So we drove down to Williamsburg, and from the minute he turned into the parking lot at 1131 Professional Drive, that was it. He had a look on his face, smile. I knew that was where he was going to buy the practice. So I think that's a great question. What is the synergy? I would say that Dr. Morrison is calm all of the time, and I am type A plus hyper majority of the time. So it's probably a really good working team. We balance each other out, and for me, it's fun to have somebody to come home and talk to about what went on at the office that particular day, bounce an idea off of him. He'll bounce something off of me. I'll say, forget it. I'm kidding. And, or he'll say, you can't do that. Like, really? So I think it works because our personalities are similar, but yet we're a great balance. So Dr. Morrison started Morrison Dental Group when he bought the practice, and I think that the core values evolved over time and really became definitive a number of years ago when we put them on paper. And that's something that we've always espoused, but we really refer to them and live those every day, and want our team to do that as well. It's the only way to really provide the type of care that you want to give to your patients, as long as you believe those core values and you are respectful to not only your patients but the rest of the team. At first it grew mainly because of Dr. Morrison's reputation in the community, and it was entirely internal referrals. And he had great stories. We'd come home and say, I got a new patient today. She's 5. Her friend told her she had to come to our practice. And those stories went on for over a decade. And they still continue to this day, but not in that intensity that it was. And I think that we evolved to a point where he couldn't see any more patients in the capacity of one office. So we expanded into a second location, and it was small at the time, and then that grew to our Norge office, which now stands as our corporate headquarters. And then we sort of decided that we were going to expand on the eastern shore of Virginia. There was an opportunity there, and we started a practice from scratch and watched that grow. It's now in its 6th year, and it's done really well. And from there, I think it became a kind of a natural path for us as the Morrison Dental Group reputation for being the patient's advocate continued to grow. Our desire to merge, expand into other geographic areas was there, and it was natural for us to expand. So I think for the patients, the goal that I have is to be able to provide the care that they need, to be able to diagnose and treat them properly, and to educate the patients on that. For Morrison Dental Group, I would say being a regional presence should give patients the comfort of knowing that we have had the ability to grow and consistently provide those same core values, same treatment across the board through all our office locations. Well, I think Morrison Dental Group is unique because you have to have some type of defining characteristic that sets you apart so that you aren't like somebody else down the street. For us, I would say it's our core values, the staff that we have, the providers that we have, and the way we treat our patients, providing them with those options like we would a family member. I think that's important for people to know that we have integrity and wouldn't do something to them that we wouldn't have done to ourselves. So for me, my role is somewhat different. I'm not on the clinic floor, but I can tell you from the charity events, and when I can go downstairs and see a patient in our waiting room here, or I go to any other office and I can go sit down next to a patient, and they tell us how great a job we're doing and how much they like the practice, that's a heck of a lot of satisfaction. For me personally, crossing things off my list, that goes a long way too.